Welcome to The Explainer. Today we're talking about something huge, a 100 billion euro industry. And it all comes down to a really personal and sometimes pretty risky decision. We're talking about medical tourism.
All right, let me just ask you this straight up. Could you ever imagine getting on a plane and flying halfway across the world for major surgery? You know, something like a heart bypass or a hip replacement.
It sounds pretty extreme, right? But believe it or not, you would be far from alone. We're talking about roughly 20 million people who make that exact same trip every single year.
And you know, when you have that many people on the move for medical care, it creates a massive global industry. The economic impact is it's almost hard to wrap your head around it. A staggering 100 billion euros. So yeah, this is definitely not some small niche market. We're talking about a true global economic force.
Okay, so let's get into it. What are we actually talking about when we use this term medical tourism? Because, the name itself can be a little misleading.
Right, so this is super important to clear up first. There's a big difference between two terms that people often mix up. First, you've got health tourism. That's all about wellness, spas, thermal baths, basically non-invasive stuff. But what we're digging into today is medical tourism, and this is completely different. This is for actual medical needs. We're talking invasive treatments like serious surgeries, cancer therapy, or major dental work.
And here's where the numbers get really interesting. Even with that gigantic 100 billion euro figure, medical tourism is actually just a tiny slice of the pie when you look at all global tourism or even all hospital admissions. So it's this weird paradox. It's a pretty marginal activity overall, but the financial punch it packs is absolutely massive. All right, let's switch gears and put ourselves in the shoes of the person at the very heart of this whole thing, the patient. Because for them, this isn't just an economic trend, it's a massive gamble. The rewards can be huge, but the stakes, they couldn't be higher.
So you gotta ask, why would anyone take a risk that big? Well, the reasons are incredibly powerful. A lot of the time, yeah, it boils down to just drastic cost savings. But it's also about access. Getting treatments you just can't get back home, or skipping these impossibly long waiting lists. And sometimes, it's even about privacy, being able to get a procedure done quietly without everyone knowing your business.
And this right here, this shows you the #1 driver in stark relief: the cost. I mean, just look at these figures. A heart bypass, $130,000 in the US, you could get that for a 90% saving in India or Thailand. 90%! A hip replacement? 80% less. We're not talking about a little coupon here. This is life-altering money. It's the kind of difference that makes traveling for surgery go from a crazy idea to a completely logical choice. So it sounds amazing, right? Cheaper, faster, maybe even better quality. It almost sounds too good to be true. And you know what they say about that? Especially when it comes to your health. There's always a catch. There are some very, very real risks here.
And these are not small risks. I mean, just think about it. What happens if you have a complication after the surgery, but you're thousands of miles away from your family doctor? There's no continuity of care. What happens if something goes seriously wrong? What are your legal options in a foreign country? Probably not great. And the scary part is, just one big problem could completely erase all that money you saved, and you could end up in a much worse spot than you were before.
But this whole thing is bigger than just the individual patient. Let's zoom out for a second. This global movement of people for healthcare, it creates these huge ripple effects that touch both the countries people are leaving and the countries they're going to. It's a really complex calculation for everyone.
So for the home countries, the ones patients are flying out of, it's a real mixed bag. On the one hand, you've got the downside. They're losing money, right? All those healthcare dollars are being spent abroad. But then, on the other hand, there's an upside. It actually creates new opportunities to export their own medical tech and know-how. And, interestingly, it can even take some pressure off their own crowded, overburdened healthcare systems.
Now, what about the destination countries? Well, for them, it's also a classic double-edged sword. The advantages are obvious. A huge influx of cash that boosts the economy, improves hospitals, creates jobs. It can even reverse the brain drain by pulling talented doctors back home. But, and this is a big but, it can cause what's called an internal brain drain.
That's where the best doctors leave the public hospitals to go work in the fancy private clinics that serve foreigners. This can end up creating a two-tiered system where local people have to wait longer for care. And that's not even getting into the really dark side, the risk of things like organ trafficking or fake medicines.
So what does this all mean for the future? Where is all of this headed? Because what's clear is that this trend is way more than just a quirky type of tourism. It's really a massive signal that the entire global healthcare system is under incredible pressure and, well, it's changing in a really fundamental way.
And this quote from our source material really, I think, just nails it. It basically says that medical tourism isn't a cause of anything. It's a consequence. It's a symptom that there's a huge mismatch between the supply and demand for healthcare in a given country. When a system at home just can't provide the care people need at a price they can actually afford, well, that leaves the door wide open for other countries to step in and fill that gap.
And that leaves us with one last and I think really critical question to chew on. As healthcare becomes more globalized and borders start to matter less and less, are we accidentally building a two-speed system? A fast lane for those who have the money and are healthy enough to travel, and a much slower lane for everyone else who's left behind. It's a huge question, really, about fairness and what the future of medicine is going to look like for all of us.